Welcome to the GRIP topic on involving young people and families in research, design and delivery. My name is Jenny Preston. I am the Patient and Public Involvement Manager for the National Institute for Health Research, Alder Hey Children's Clinical Research Facility, and Patient and Public Involvement Priority Lead for the National Institute for Health Research Clinical Research Network Coordinating Centre. My role for the past 10 years has been to develop a strategy for the effective involvement and engagement of young people and families in the design and delivery of paediatric research. This topic is split into 5 sections. What is involvement and why bother? Approaches to involving young people and families in research, highlighting models developed by the NIHR Clinical Research Network Children. We will look at the research focus and study design and how this impacts on the approach one takes to involvement and specific methods researchers might use. We will focus on how to plan involvement activities, and finally we will look at the impact of involvement and the importance of giving feedback. The main learning objectives of this topic are to understand patient and public involvement in the social and political context, to explore approaches to PPI in research, to learn how to implement PPI in research, and to look at ways of measuring the impact of PPI. So let's take a look at what involvement is and why bother involving young people and families in research, design and delivery. Involvement in research means undertaking research activities with, rather than to, about or for patients. It means involving patients, carers and the public who have personal experience of or an interest in health conditions in research or related activities. It's an active partnership between patients and the public and researchers, doctors and other NHS staff. Click on Tom's story to hear why he got involved in research activities. In the UK, the involvement of patients and the public in social and healthcare policy has been well recognised since 1996. Research projects and programmes funded by some health and social care funders, PPI is mandatory and for others it is strongly encouraged, including in the United States where it is known as stakeholder engagement. Every day hundreds if not thousands of patients and the public go the extra mile to help make research happen in the UK. Their contribution is many and varied. One of the most important ways in which they make the difference is by improving the quality of research, how it is designed, conducted and delivered. Within the NIHR, such is the extent to which the public have become involved that research is increasingly becoming a joint venture between patients and the public, researchers, clinicians and health professionals. The NIHR believe that if we are to meet the health and social challenges of the future, then these partners must be empowered, encouraged and supported to work together. The same vision applies to involving young people and families in relevant research. As the UK Chief Medical Officer's 2012 annual report highlights, this expectation for patient and public participation has no age limit. Children and young people should be encouraged and facilitated to participate in decisions about their own care and, more broadly, about the health and social care services and policies that affect them. This leads us nicely into why involving young people is important. In 1989, governments worldwide promised all children the same rights by adopting the UN Convention on the Rights of the Child. The Convention changed the way children are viewed and treated, in other words, as human beings with a distinct set of rights instead of as passive objects of care and charity. These rights describe what a child needs to survive, grow and live up to their potential in the world. They apply equally to every child no matter who they are or where they come from. The Convention has 54 articles that cover all aspects of a child's life and set out the civil, political, economic, social and cultural rights that all children everywhere are entitled to. It also explains how adults and governments must work together to make sure all children can enjoy all their rights. The Convention must be seen as a whole. All the rights are linked and no right is more important than another. However, the highlighted 3 articles relate to young people's right to participate in decisions that affect them, the right to good quality healthcare and information to help them stay healthy. Click on the link to find out more about the 54 articles covered by the Convention. We are now going to look at approaches to involvement. Previously, the terms consultation, collaboration and user-controlled have been used to describe different levels of involving people in research. Over time, it has become clear that in practice, research projects can include a combination of these three, and also that the boundaries between them are not clear-cut. It is therefore more helpful to describe them as approaches rather than levels. Within these approaches, there are many different ways of involving members of the public during the various stages of the research. For example, you might work with one or two patients or carers as co-collaborators throughout a research project, as well as consulting with a wider group of patients on a specific aspect of the study, or members of the public might lead on one stage of the research. How you involve people will depend on the nature of your research, as well as the different activities people decide they would like to get involved in. The next few slides will highlight the approaches the NIHR Clinical Research Network Children, originally known as the NIHR Medicines for Children's Research Network, adopted to involve young people and families in their research activities. The network has been at the forefront of patient and public involvement in research for some time. In 2006, the network adopted a collaborative approach to the involvement of young people by setting up its first Young Persons Advisory Group based at the Network Coordinating Centre in Liverpool. Since then, 4 more groups have been established in London, Nottingham, Birmingham and Bristol, and is now known as Generation R, R for Research. Each group has approximately 15 to 20 members aged between 8 and 19 years old. Some have medical conditions, all of them have an interest in science or medicine, and some would like to become our future doctors. The purpose of the group is to engage young people with research and to work in partnership with and offer support to researchers. The group provides a forum for young people to learn about and comment on various aspects of the research cycle, from the identification of research questions to the dissemination of research findings. The group also works along national and European governing bodies such as the Health Research Authority and the European Medicines Agency, as well as organisations such as the Royal College of Paediatrics and Child Health, helping to remodel guidance they provide to researchers to help them design and deliver ethically robust research for children, as well as support researchers in the design and deliverability of their studies. In a 2014 review undertaken by the National Children's Bureau of the group's activities, the group took part in over 60 activities to support individual research projects. The majority of activities focused on the practical implementation of research and the design of patient information sheets. We are increasingly trying to engage researchers at the earliest stage possible in protocol development to ensure the outcomes and acceptability of the study suits the needs of patients and families. Several examples of this can be found in the highlighted report. Click on the report to find out more. To find out more information about the work of the Generation R Young Persons Advisory Groups, click on the link to the recently launched website. Here you will find information about how to contact a young persons group, meet the team, and keep up to date on research-related activities and resources. Patient involvement should occur throughout the duration of a research project. One particular example of a project I am working on is called MetPhys, which is a clinical development project to develop a new soluble formulation of metformin for treating polycystic ovary syndrome in adolescent girls. MetPhys receives funding from the 7th Framework Programme of the European Union and is coordinated by Efrex Pharmaceuticals, a specialty pharmaceutical company. This project is a partnership between Alder-Hey Children's Clinical Research Facility, a pharmaceutical company, and young patients with polycystic ovary syndrome. The overall expectation is that patients will be involved throughout the project, inputting on a range of aspects over time, including the presentation and packaging of medicines, the study protocols, the outcomes to be measured in the study, as well as patient information leaflets. So far, young people have contributed to the presentation, packaging and flavour of a new formulation of metformin, reviewed the study protocol, discussed important outcomes important to them, and reviewed patient information sheets. The next phase will be to develop lifestyle materials for young people affected by this condition to be used in clinics. There are many ways to involve parents and carers in research activities, for example through focus groups, family awareness days, virtual discussion groups and so on. Very similar to young people's involvement, you have to take into account that parents and carers are busy people, often looking after very sick children, so flexibility is crucial. Arranging meetings outside of school hours or at weekends and providing childcare are important considerations. The best way to identify parents or carers is to work with local and national patient organisations such as People in Research or International Alliance of Patients organisations. CRN Children have involved parents and carers in numerous activities over the years. Most of these activities have been undertaken through the 14 Children's Specialty Clinical Studies groups, who provide expert advice to help researchers develop high-quality research proposals. Parents have been involved in a research priority exercises to identify research ideas of importance to patients and their families. They have contributed to the design of studies and have become co-investigators on several research projects. Click on the CSG brochure to find out more about their work. The last few slides are examples of how we as the NIHR Clinical Research Network and Alder Hey Clinical Research Facility have undertaken research activities with young people and families. Your involvement activities will depend entirely on both the research focus, for example mental health, young people with a particular health condition, or effectiveness of a new treatment and chosen study design, for example the type of methods the research team use, such as randomised controlled trials or face-to-face interviews. So dependent on your research focus and study design, there are several questions to consider to plan your involvement activities. Let's start with why you want to involve young people and families in your research project. What do you want patients to do? What will be the main outcome? Patient involvement in research can challenge many of the values and assumptions that academic researchers hold. These may be values about what constitutes research quality or about the appropriate role of patients and families in the research process. It is important to identify and acknowledge these values as they will shape the impacts that the research team anticipate from patient involvement. Who do you want to or need to involve? Are there particular groups of young people or families you could or should involve, for example Generation R? Is it possible to consult other young people on your proposed plans? What type or model of involvement would be appropriate for your research? Collaboration, consultation or control? What stages of the research and in what roles could young people and families be involved? How will you resource involvement activities both in money and staff time? Do you have sufficient involvement expertise within the team or know where to access this? These are very important considerations prior to undertaking any involvement work. Here are some top tips to help you plan involvement activities. Plan involvement as early as possible. Be clear about what patients can and cannot do in the project. Ensure all members of the research team understand the reasons for involving patients and agree the approach you adopt. Support patients with training and information throughout the duration of the project. Identify a key person within the team for patients to contact. Reimburse travel expenses. Where possible, offer childcare or carer expenses. And most importantly, give feedback about their contributions. A really important factor is budget considerations. Involving patients and families will obviously have cost implications, and this will depend entirely on the following factors: how many patients you plan to involve and how often, travel costs, childcare or carer costs. Other considerations include room hire for meetings, refreshments, bespoke training, stationery and payments as a thank you for their contributions. To help you with budget management, click on the guidance tool produced by the National Institute for Health Research, Mental Health Research Network and Involve. The impact of patient involvement can relate to the research itself, for example data collection, design and delivery and time and cost, or to the people involved, so members of the public, academic researchers and funders. Identifying the impacts expected at the beginning may shape the processes and actual impacts of patient involvement. Some impacts may be seen in the short term, for example on patient information documents. Others may take longer to be seen or be more complex to identify, for example on recruitment or retention. Public involvement can have an impact on all stages of the research process, from topic prioritisation through to dissemination. Impacts of public involvement can be experienced as positive or negative. They may also be intended or unintended. To help you assess the impact of public involvement in your project, a Public Involvement Impact Assessment Framework guidance document was developed by a research team made up of academics from the universities of Exeter, Lancaster and Liverpool, supported by a grant from the UK Medical Research Council. Click on the link to find out further information about how to measure the impact of patient involvement in your research. Hopefully this brief introduction to involving young people and families in research has given you the basic skills and additional resources to undertake future research activities with patients. To learn more about how to involve patients and the public, the next 2 slides gives you a list of key resources.